Visual field testing is an assessment of the panorama of achromatic vision. It complements the assessment of visual acuity, which measures only the central degree or two of the visual field where the cones provide high resolution and color vision. You will do informal visual field testing by using the Amsler grid and by finger confrontation. In the Amsler grid test, patients draw their own visual field defects. It assesses only the central 10 degrees of the visual field, and patients must be aware enough of their defects to draw them. The other informal visual field test is finger confrontation. This test is limited to detecting dense and large hemianopic and altitudinal defects. To screen for gross visual field defects, ask the patient to identify fingers displayed first before one eye, then before the other.
1, 2, 1, 1, 2, 1, 1, 2, 1, 3, 1, 3, 1, 2, 3, 4.
Suppose the patient cannot see any fingers displayed in a hemifield. Here's what you should do. How many?
1, 2, 2, 1.
Tell me when you first see my finger by saying the word now.
Now. Now.
The results of confrontation visual field testing should be recorded on two circles corresponding to the visual field of each eye. The left circle applies to the left eye, the right circle to the right eye. Divide the circles into 4 quadrants by a horizontal and vertical line that cross at the point of fixation. If the patient can count your fingers displayed in each quadrant, mark that as CF. If not, darken in that quadrant. For example, a patient who cannot count fingers in the nasal quadrants of the right eye's visual field and the temporal quadrants of the left eye's visual field has a left homonymous hemianopia. If you want a sensitive and quantitative assessment of visual field loss, you must go to formal testing, also known as perimetry. The main drawback of perimetry is that it requires expensive equipment and attentive patients. Here is how it goes. Formal visual fields are usually performed by placing the patient's head in a white bowl and having her maintain her gaze straight ahead. Lights of different intensities are projected onto the bowl, and the patient is asked to press a buzzer if she sees the lights. The results of formal static visual field testing are displayed on a data sheet. A series of threshold points tell you how well the patient could see at those points in the visual field. Small dots tell you that the patient could easily detect a dim light at those points in the visual field. Dark squares tell you that the patient could only detect a very bright light at those points. The examiner studies the patterns of the defects in both eyes to determine where in the visual pathway the responsible lesion lies. In this case, the right eye has a temporal hemianopic defect, and the left eye has a nasal hemianopic defect. This is called a right homonymous hemianopia. The lesion lies behind the optic chiasm on the left side of the brain. To learn more about the interpretation of visual field defects, go to Visual Fields Part 2.